Thanks, Nate. Hello, I'm Brad Mall. You might recognize me as Dr. Tony Jones from the soap opera General Hospital. In 2004, I stopped acting for a few days and played the real-life role of a patient and had laser vision correction. Just like you, I was tired of waking up every morning to a blurry world and hassling with contact lenses that constantly caused me problems under the bright lights in the studio. Well, those days are over for me. I'm now totally free of what I considered was a real handicap. Laser vision correction has completely changed my life, and chances are, if you have the procedure, you'll enjoy the same excellent results that I experienced. By now, you're probably far enough along in the process to know that you're a pretty good candidate for the procedure. Hopefully, you've done your research and talked to other people who have had it done themselves. And I bet you're probably starting to get excited about the prospect of life without dependence on glasses or contact lenses. But what I would like to do for the next few minutes is make sure your expectations are realistic. I'll review some of the information you may already know about the procedure. Then I'll cover some of the more common risks and complications that have been associated with it. After all, laser vision correction is surgery, and no matter how routinely it's performed, there's always the potential for side effects and complications. Although the percentage of complications is relatively low, should you experience one, your results might be affected even to the extent of making your vision worse or your occupation difficult to perform. Ultimately, only you can make the decision to have laser vision correction, and that decision needs to be based on your knowledge of both the risk as well as the benefits of the procedure. So, the goal of this program is to supply you with information to help you make a better informed decision before you give your consent for surgery. During the next few minutes, you might want to take notes. I'll walk you through a brief quiz at the end of the program that will show your doctor that you understand the information I'll be presenting. In this program, we're going to cover photorefractive keratectomy, more commonly known by its initials, PRK. Originally performed in the late 1980s, PRK has continued to evolve with the aid of technological advancements in excimer lasers, surgical techniques, wavefront diagnostics, and custom treatments. Because the procedure has changed so much, not everyone calls it PRK anymore. Today, it's often called names such as advanced surface ablation, advanced surface treatment, Lasek, not to be confused with Lasik with an I, Epi-Lasik, and probably a few of the names I'm not even aware of. Although various aspects of each of these uniquely named procedures differ, they're all refinements of the original PRK, which is basically laser vision correction that is performed on the surface of the cornea. And since I have to call it something in this program, I'll just pick one. How about advanced surface treatment? Advanced surface treatment is considered an elective procedure. This means you're having this permanent, non-reversible procedure because you want to, not because you had to have it. After all, you could just continue relying on glasses or contact lenses for vision correction. There may also be other types of refractive procedures that could correct your vision that are available now or could become available in the future. Some of these could have fewer potential side effects and complications and even produce better results. So be sure to discuss these possibilities with your doctor as well. And by the way, refractive procedures applies to all procedures that alter the way light is refracted or focused by the various components of the eye. And there are different types of refractive errors caused by irregularities of the eye. The most common refractive errors are nearsightedness, farsightedness, and astigmatism. These are known as lower order aberrations and have been traditionally treated with glasses, contact lenses, and conventional laser vision correction. But most of us also have refractive errors called higher order aberrations, with names you probably are not familiar with, such as coma, trefoil, and spherical aberration. These can now be addressed with custom wavefront guided procedures and can affect the overall quality of vision one experiences. To better understand how the laser corrects refractive errors, it helps to understand how the eye works. In order for an image to focus clearly on the retina, the cornea must be of the proper curvature. After entering the cornea, light rays then pass through the pupil and through the natural lens of the eye to come to a point of focus directly on the retina. Nearsightedness occurs when the cornea has too steep of a curve or the eye is too long in relation to its corneal curvature. This causes images to come to a point of focus in front of the retina instead of on it. Nearsighted people can usually see very close objects clearly, but their distance vision is blurry. If the cornea is shaped like a football, more curved in one direction than the other, they have regular astigmatism. Astigmatism causes light rays to bend in such a way as to create no single point of focus, resulting in blurry and often distorted vision. Farsightedness occurs when the cornea is too flat or the eye is too short. This causes light to come to a focus at a hypothetical point somewhere behind the retina. People who are farsighted can experience blurry distance and also blurry near vision. But when a farsighted person is young, their distance vision is usually better than their near vision. This is because the lens inside their eye is able to change its shape, helping to bring their vision into focus. We call this ability accommodation. As we age, whether we are nearsighted, farsighted, or normal-sighted, usually around age 40 to 45, the lens inside the eye begins to gradually lose its ability to change its shape. This causes us to pick up reading glasses to read small print, or we begin wearing bifocals or even trifocals to see well at all distances. This naturally occurring condition is called presbyopia. But if a nearsighted person beyond the age of 40 or 45 were to take off their glasses or contact lenses, their distance vision would be blurry, but they can generally see better up close than they could with their glasses or contacts on. So, when a nearsighted person in the 40 to 45 age range has both of their eyes corrected for clear distance vision with glasses, contact lenses, or in this situation, laser vision correction, they may find themselves needing reading glasses to see clearly up close. If you are approaching or over the age of 40, you may want to discuss having monovision or blended vision with your doctor. This is where one eye is corrected for near vision and the other eye is corrected for distance. Your procedure will be done during a brief outpatient visit. You'll need to arrive about an hour before your scheduled procedure. You'll be given eye drops and possibly a mild sedative. You will remain awake and should be quite comfortable during the procedure through the use of very effective anesthetic eye drops. Your eyelids will be held open to prevent you from blinking. Epi-Lasik is different from other forms of advanced surface treatment in that it actually uses a special instrument called an epikeratome to make a hinged epithelial flap. You will be asked to look at a fixating light as the laser reshapes your cornea, often within a minute or so. Advanced surface treatment uses ultraviolet light from an excimer laser to remove tiny amounts of tissue from the cornea with accuracy up to 0.25 microns with each pulse. If treating nearsightedness, tissue is removed from the center of the cornea, moving the point of focus from in front of the retina to on the retina. If treating farsightedness, tissue is removed from the outer margins of the cornea, moving the point of focus from behind the retina to on the retina. If treating regular astigmatism, tissue is removed from the steeper areas of the cornea, creating only one point of focus on the retina. If you have astigmatism along with nearsightedness or farsightedness, the laser will treat both problems at the same time. After treatment, the epithelial flap is folded back over the treated area. You will then be given additional eye drops, and a special bandage-like contact lens will be placed on your operated eyes. You will continue wearing the lens for a number of days while the epithelium regenerates and grows back over the cornea. After the procedure, you will need to have someone drive you home. It's best to sleep as much as you can during the first 24 hours. You may be given medication to relieve any discomfort you experience for a few days following the procedure. This discomfort is often described as a sensation similar to having an eyelash in the eye and can vary from mild to moderate. If you experience pain that cannot be relieved by medication or lasts longer than 72 hours, you should call your doctor. If the pain is severe, you should call immediately. How well a patient sees immediately after surgery varies quite a bit from one person to another. Most patients see a dramatic improvement within days. For others, vision may be blurry for several weeks to several months. You should not drive until you are certain your vision is adequate for driving. Both eyes are often treated on the same day. However, should you have just one eye treated at a time, you may experience an imbalance between your eyes. This could impair your ability to work and drive unless temporary glasses or contacts are used to minimize the refractive error between the two eyes. The goal with advanced surface treatment is to improve your functional vision by reducing or eliminating your dependence on corrective lenses. However, it does not always create 20/20 vision, and your doctor will not guarantee this result. In fact, not all eyes are even capable of seeing 20/20 or better, even if you are considered an ideal candidate for either conventional or custom treatment. But the good news is that the vast majority of people who have advanced surface treatment are able to pursue the normal activities of daily living without dependence on corrective lenses. If you do still require correction after the procedure, the lenses in your glasses will usually be thinner and more attractive than the ones you're probably wearing now. If you wear contact lenses successfully now, chances are you'll be able to wear contacts successfully after the surgery, but it may be more difficult or even impossible if the cornea heals into an irregular shape. If your eye is overcorrected or undercorrected by the initial procedure, it can often be retreated with additional surgery, but not always. Some patients may also experience an excellent initial result, only to have the effect diminish over time. In some, but not all cases, retreatment can help. Vision, even in normal eyes, tends to diminish over time due to the natural aging process. You will be given antibiotic eye drops to use for a week or so to reduce the risk of infection. Steroidal or non-steroidal eye drops may also be prescribed to minimize the development of corneal haze. However, prolonged use of steroids can cause a number of sight-threatening problems. It is extremely important that you keep all follow-up appointments to monitor your progress and take all medicines as directed. Your results depend on following your doctor's instructions. If you do develop some degree of haze, it will usually be mild and should diminish over time with little or no effect on your final visual results. Rarely, corneal haze can progress and cause scarring. Retreatment with the laser can usually correct this problem. Almost everybody experiences some degree of visual side effects for a time after the surgery, including increased light sensitivity, glare, and halos around lights. Although they are usually mild and temporary, they might not go away completely. However, newer laser software that allows for a larger treatment area and the introduction of wave-front guided treatments have demonstrated significant improvement in the quality of nighttime vision after laser vision correction. But at night, many people, whether they've had laser vision correction or not, experience a slight blurring of vision, especially if they have wide pupils. People experiencing this condition may find they need to wear corrective lenses to fine-tune their vision for nighttime activities such as driving. Additionally, your eyes may feel drier after the procedure, and artificial teardrops may be needed for several months or even permanently to relieve this condition. However, this side effect is usually less severe after advanced surface treatment than with the Lasik procedure. Treating the surface of the cornea is generally considered to be a safer procedure than Lasik for patients with thin corneas or other corneal abnormalities. Complications relating to making a Lasik corneal flap are avoided with surface treatment. You should also be aware that some patients have actually lost several lines of best corrected vision. This means if a person were able to read the 20/20 line with their glasses before the procedure, they may not be able to read the 20/20 line with glasses or contacts after the procedure. This loss of best corrected vision can be due to scarring, decentration of the treated area, and irregularities in the surface of the cornea. There's also the remote possibility of infection, drug reaction, or other rare occurrences that could cause the loss of vision or the need for a corneal transplant. Another possibility before or during the procedure, the excimer laser could malfunction, causing the procedure to be stopped or postponed. In this program, I've covered some of the more common side effects and complications associated with advanced surface treatment. Please understand that it would be impossible to cover all known and unknown risks that have occurred in the past or could occur in the future in a program such as this. However, surface treatment of the cornea has been performed since the late 1980s and has shown good long-term stability. Millions of people all over the world have undergone laser vision correction, and the vast majority of patients, like me, are able to pursue the normal activities of daily living without dependence on corrective lenses and have found their results to be extremely satisfying.